So many women, if not all, have experienced painful sex. Okay, there are many times women will just not want to have sex with you because they are having painful intercourse with you. And there are a couple of reasons as to why women might have the painful intercourse. Okay, sometimes it is so bad they dread it is just scary to engage in sexual intercourse. I will give you a couple of reasons why you might have a painful intercourse. Couple of causes that might be the reason why you always or sometimes get the painful intercourse. So please subscribe to this channel. Clearly, it is a very informative channel. Let's go together. So reason number one as to why you might be having painful intercourse is not achieving the desired amount of lubrication. Okay, lubrication can be natural, lubrication can be artificial. Okay, you can use oils to lubricate before having penetration, and you can actually do enough foreplay or just give the lady enough time for her to be able to get wet and lubricate as desired. Okay, so do not engage in penetration if lubrication has not been achieved, because the lady will experience a lot of friction and there will be pain, okay, owing to inadequate lubrication. The second one will be trauma. Okay, trauma like pelvic trauma. Okay, accidents might have happened. Okay, the other thing will be an episiotomy right after birth. Many ladies receive something called an episiotomy to give enough way for the baby to be able to be delivered. Okay, so unhealed episiotomies would really cause a painful intercourse. The other thing would be female genital mutilation, FGM. Some communities still do it, and it is a leading cause of painful intercourse for ladies. Okay, for ladies who have already undergone FGM, it is a bit hard for them to achieve the natural lubrication. Okay, so they are advised to actually go with the oils for lubrication. Okay, the other thing will be infections and skin conditions. Okay, infections like UTIs are very leading causes of the painful intercourse. Just visit your doctor for some antibiotics for treatment, and then you are back in the game. The other thing is vitu kama eczema. Okay, things like eczema will really affect your sex drive and also can cause trauma. Okay, as much as eczema will affect your skin here, it will affect your skin there as well. Okay, so there's a lot of chances that you will get sores and you will get a lot of friction from eczema. So get your dermatologist consult and you will be good to go. Okay, the other thing, vaginismus. Vaginismus is muscle spasms around the vaginal area that could cause pain while having sex. Okay, so just consult with an OBGYN. Some exercises will be very useful for you so that you can stop having the very painful intercourse. Another reason or another cause is a problem present at birth. Things like vaginal agenesis, where your vagina might not be fully formed. Okay, so when there is penetration, there will be pain because your vagina is not fully formed. Okay, there will be things like imperforated hymen, where the opening of the vagina will be closed and not opened, so there will be a lot of pain, especially for the first couple of times, and sometimes impossible to penetrate. Too painful and actually impossible to penetrate. So you just visit a doctor. Sometimes a minor surgical procedure will be done and you'll be good to go. Sometimes you can have deep pain deep inside deep inside, and most of the times it will be caused by illnesses or conditions that might be deep inside, not around your vagina but deep inside. Things like uterine fibroids, hemorrhoids, cystitis, ovarian cyst, pelvic inflammatory diseases, uterine prolapse, irritable bowel syndrome, and so many others. Okay, so if you have pain that is not out of trauma or lubrication problems, please visit your doctor for more screening, more treatment, so that you be comfortable while having sex. The other cause, surgeries and medical treatments. Surgeries like hysterectomy, where most of your reproductive organs are removed, and treatments like radiotherapy for cancer and chemotherapy for cancer will actually have an effect of painful sex right after the treatment. Okay, the other cause, psychological issues. Yes, psychological. Okay, things like anxiety, depression, fear of intimacy, fear of how you look. Okay, those things can actually give you a delusion of painful sex, because these things are likely to affect your arousal, okay, and your lubrication. Okay, so there is a very high chance you will get painful intercourse because you will be dry, okay, from your psychological issues. Last one is history of sexual abuse. Okay, some people will not be able to come out of the abuse psychologically. Okay, so every time they try and engage in sexual intercourse, something will hinder their arousal. Okay, so there will be now the psychological issues coming in and hindering lubrication, thus having painful and uncomfortable intercourse. Okay, so no woman is supposed to go through painful sex. No woman is supposed to have sex as something that traumatizes them and makes them go through pain. Okay, so if you're a lady and you're going through pain while you're trying to pleasure yourself or your partner, please visit a hospital and tell a doctor what you're going through. Okay, so that if you need counseling, you will go through it. If you need screening, you will get it. If you need treatment, you will get it. Do not stay at home and wait for it to get better. No. Okay, no, unless it is a lubrication problem where you can buy oils. Otherwise, please visit a doctor and get yourself treated so that you can bounce back into the game. Thank you for watching. Please subscribe. Bye.